Hello, CJSN listeners. I am Joseph Lunyera from Duke University School of Medicine, and I'm here with two of my co-authors to discuss our new study. In this study, we examine the relation between psychosocial factors and chronic kidney disease outcomes in Black Americans. Before we introduce the study, I'll invite my co-authors to introduce themselves.
Hello, I'm Clarissa Diamantidis. I'm a nephrologist and clinical epidemiologist at Duke University.
Hello, I'm Mario Sims, and I'm an socio-epidemiologist and the Chief Science Officer for the Jackson Heart Study at the University of Mississippi Medical Center.
Thank you. Clarissa, can you tell us the rationale for examining the influence of social determinants of health, such as psychosocial factors on kidney health, especially among Black Americans?
Sure. 3 key reasons come to mind. First, CKD affects 30 million adults in the United States and is more common among Black Americans than whites. Second, despite efforts to narrow the racial disparity in kidney outcomes between Blacks and whites, the risk of CKD remains disproportionately higher among Blacks. Finally, for the most part, efforts to prevent CKD have predominantly focused on improving control of established risk factors, such as hypertension and diabetes. However, recent work suggests that social determinants of health, such as psychosocial factors like anger or stress, may affect kidney health, but not a lot of research has been done in this area.
So one key consideration in examining the link between psychosocial experiences and human health is the need to include a wide range of psychosocial instruments to capture the full range of human experiences. For example, experiences that may be important to some may not be quite as influential in others. With that background, Mario, can you talk about the psychosocial factors that we included in our work and why we reduced them into a few underlying constructs?
That's exactly right. It is important to include measures that capture the full range of psychosocial experiences in this type of study because many of the experiences that we study in social science are related in terms of how they influence health outcomes. However, including interrelated measures in the same analysis often requires the use of a statistical approach that groups the correlated measures into components that are not related.
Thank you, Mary. So in our study, we reduced 12 psychosocial measures into 3 non-correlated components or groups. The life stressors component included perceived discrimination and measures of stress, and the moods component included hostility and anger. And the coping component included John Henryism, social status, perceived social support, spirituality, and pessimism. We found that participants who had greater experiences of life stressors were less likely to have prevalent CKD at baseline, specifically among Black women. After follow-up, none of the 3 components were associated with kidney function decline or incident CKD of a median follow-up of 8 years. So as we wrap up our discussion, Clarissa and Mario, could you highlight how our findings inform future research in this area?
Sure, Joseph. I believe future work should focus on exploring biological mediators related to the influence of psychosocial experiences on health. It takes a long time for social experiences to potentially impact kidney outcomes such as CKD, so studying intermediate effects of these experiences becomes important.
I totally agree. I also believe that future research should examine potential behavioral responses, like ways of coping with stressors, which might offset the health consequences of negative experiences in Black populations.
Thank you to you both and to CJSN listeners.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.